Hey Dan, how are you doing? How are
Hi,
Hi, how are you?
good. How are you?
Good, good.
Good.
So
To
Dan,
see you.
congratulations on your new position. I'm really sorry to see you leave, but happy for you.
Thank you. Yeah, we're working right now on writing an additional assignment to possibly keep me on board with the grant for a couple hours a week.
Oh, okay.
So hopefully that goes through and all works, but
Yeah, you're going to be busy. So,
yeah.
so Tara, how, in terms of the other course you're taking, instead of, in addition to 7035, is that going to work out with you and the other course?
I believe so, actually. So both syllabus. I actually am on my way back from North Carolina
Oh,
with my mom and my sister. We went to the Biltmore for Mother's Day.
oh,
So
nice. Oh, good
yeah,
for you.
yeah. But looking at both syllabuses, I actually think the few days that you have us asynchronous are the few days that the 9505 will meet. So I think it will work out actually really great.
Good.
And I'm waiting for clarification, but I think tonight's class for 9505 starts at 5. So I can at least, hear the introduction, say hello, and then I can, I'll log into our class. So
Okay, and if for some reason that doesn't work out, my classes are all going to be automatically recorded. I'd forget to do it if I didn't set it up automatically. So, so and so when I get those at the end of class, I will post them so you've got them. But yeah, I sent Dr. Walker my uh, plans for the schedule, and I assumed it was going to work out. So it's not, and then sometimes I'm like, well, what if I sent her the wrong dates or something? But it sounds like it all got done. As
yeah, no, I think it'll work out
good.
great. And when I'm back home and settled, tomorrow, I'll definitely be able to line it all up perfectly, and then, just give a heads up well in advance so that, I can make plans to
Yeah.
make sure I am prepared for that content, and,
Okay.
you know,
Good.
can, send my participation stuff early or
Yeah.
whatever I need to do.
Good.
So
So Dan, how many students are you expecting here today?
All 9 should be here. No
Oh,
one has
good.
told me that they can't. So
Okay. Okay. Good. Good. We're in
once
a
again,
little bit.
fingers crossed.
Yeah. And it's being recorded too. Same thing. So
Mhm.
you can always look that up. It's going to be pretty short because there's there we go. It's not a lot to talk about necessarily, compared to some of the other courses. Hi,
Mhm.
Alyssa.
Hello,
How are you doing?
I am good. How are you?
I'm okay. Dan, is it just you? Is Dr. Dante Smith going to be here also, or?
She is tentative.
Okay.
She had to go on campus for something today, so she said if the timing works out that she's not in the car driving
Okay.
between home and campus, then she'll be here.
Okay.
So how's the first day of classes going for everyone?
Okay, haven't started yet, so.
mine aren't until the evening. So we'll see. We'll see.
And she really can't say because I'm her faculty for that too. So she's
Yeah, I mean, I am already prepared, so we're good to go. We're good to go.
okay. Yeah, it's going to be a long day. What I don't fully get about that course is it's always the full 3 hours, but my other courses have like this, time carved out, like you're moving from place to place. And I don't understand why this course is exempt from that. looks like we've got a fifth person here. We're getting there.
I just realized I should probably take a quick attendance while people are logging in, just so we can track everything.
Yeah.
Hannah, are
Yeah.
you related to Natalie?
I am.
Okay. I like semi assumed, but didn't want to assume, and it didn't have anything connecting your accounts on like our systems or anything. So
Yes, we are related.
I will admit that was surprisingly more difficult with the organization of your emails and applications and stuff than I thought it should have been. I was just like,
Really?
wait, because it's both with a
And then
new and
sending
I'm
it to the
used to
same
only
one.
doing 9
Yeah.
students, so the same last name, it just kind of like wasn't something I was used to, but I think I got it all figured out.
Okay.
Hi, Jill. Long time no see. Yeah. Like every other day. So we have 1, 2, 3, 4, 5, 6, 7.
I think
Expecting
we're
a
missing
couple
one.
more.
Hello, everybody.
Hi, Tracy. How are you?
I'm good. How are you, Dr.
Good.
Weirs?
Good. Truly long time no see.
I know. I get to see you twice in the same day.
Yes, that's right. Yeah, Jill, we have class tonight at from 6 to 9 for the FNP students. So, all right. So we're 1, 2, 3, 4, 5, 6, 7, 8, 9. Do we have all your students then, Dan?
I think we do. I have everyone's name marked off. So
Okay. So, Jill, feel free to jump in. Oh, hi, Leon. So feel free to jump in, Jill, if there's anything I'm missing or misrepresenting. First of all, most of the students know who I am because they've had me for theory or leadership or something. So, and for those of you who don't, I'm Dr. Weirs, and I am faculty at the College of Nursing, but I also am an AHEC Scholars faculty also. So you'll have me for the summer, and actually you'll have me starting in the fall for year 2 also. So Leon, do you want to do your piece at all? Is there anything? No, nothing do you want to say? Okay, you're just going to chime in if I make a mistake then. Is that it? From that look? Okay. Just didn't know he had something specific you wanted to go over with them, but I have a slide, so you'll probably want to make a comment on that. Let me find my slides. Okay, I've got it. Now I gotta get back to you guys. All right, here we go. You guys can see that okay?
Yes.
Okay, so I am going to take you through a tour of Canvas. I'm not Canvas, Moodle, rather, sorry about that. But I thought I'd go over just a few of the concepts initially here in terms of the course and what it's about. I know some of you I helped recruit, and I'm not sure how much information you got from everybody though. So this is AHEC Scholars, Michigan AHEC Scholars Year 1, and specifically you're all in the ANU grant in your various settings. And I will be your faculty for year 1 this summer, and bear with me because I have only been with AHEC since mid-January, and I did take over or inherit a year 2 group, so I have a more familiarity with that. But so we'll learn a little bit together here, and I have people on hand. It's nice if you have your video monitors on because I like to see your faces. Some of you I don't know, and it's just I think in this time of COVID and all of the Zoom meetings, it's very impersonal at times. So this is a small enough group we can do that. I would like Leanne Hudson and Jill, to each of you, just wouldn't mind introducing yourselves really briefly. Just say who you are and what your role is. That'd be very helpful.
I'll go first, Jill. My name is Leon Hudson. I am the project manager for Michigan AHEC, and my role with the AHEC Scholars and association with the ANU is I do all the reporting and evaluation for the programs. And what I've done, I'm also the administrator for the Moodle website. So if you have technical issues with Moodle, feel free to contact me. You know, you forgot your password, you couldn't find your email with your password, fine, I'll help you with that. But if you ask me about, well, what does this question mean? I ain't gonna be able to help you because that's gonna be a Jill and a Dr. Weir's question. I'm only here technically. That's all I can do. So feel free to contact me by email or by telephone. You'll have all that information in the email that I'm going to send out. Once Dan gives me permission, I'm going to send that email out to you, giving you access to the website and the course. Okay, so good luck. Thanks for joining us.
Okay, Jill, you're on.
Hi there. My name is Jill Horner, and I am actually the budget analyst at Michigan AHEC, but on the AHEC Scholars Program, I serve as the teaching assistant. So I do help to populate the activities in Moodle. I don't do any of the grading in there, but if you do have questions, if a link doesn't work, something like that, you can definitely reach out to me and I will help you the best that I can. If I can't, then I will pass the question on to Dr. Weirs. But I will also send you reminders for things. I will send you, like a monthly reminder of what is coming up that is due, as well as if there's any other updates, information that Dr. Weirs or I need to convey to you, I will send you that email. But in that email, I put the newest updates on top, and then I keep the important ones going. And Leon's email address will always be in there in case you do have any sort of technical issues with Moodle. But my email will be in there as well, and my cell phone number. You'll find that too on the syllabus in Moodle. But in an effort to not have a bunch of emails going to Dr. Weirs, you can always email me first. I'll try to answer your question as best I can. And if I can't, then I'll pass it on to Dr. Weirs.
Okay. So Dan, do they all know you? Do you need to talk to them too at all, or?
I don't know if I've had a chance to meet everyone,
Okay.
But they've definitely gotten plenty of emails from me. So
they have a sense of what you're doing. Okay.
I think so.
Okay.
But just a quick overview. I've been working with the ANU grant since its beginning as the grant assistant / manager. I've been just kind of making sure that all of our goals are being met and that we're tracking all of our data and putting in all of our reports. Technically, on the books right now, my last day with the grant is this upcoming Friday. But we're working on a process of getting me to continue in the grant till October as a part-time capacity while I move on to a new position. So hopefully this won't be our first and last meeting, but we'll see.
Which we're all happy for Dan, but sad about, because he's very helpful to all of us. And I know Dr. Nancy Smith relies on him greatly. So I would like the students one by one to just introduce yourselves. I am looking, let's do this. Who wants to go first? Just butt in there.
I'll go first.
Thank you.
My name is Tracy Stanish, and I am doing the part-time route, and I'm starting the third of 4 years.
And which program are you in? I know the answer, but.
The FNP, the DNP FNP route.
Okay, I can only see a couple of you and I don't want to pick on a specific
I
person.
can go next.
You were my target if not. Okay.
I'm okay with that. My name is Alyssa. I'm also in the FMP route. This is going on, I guess, my third-ish year or the end of my second. So I'll be done next July.
Hi, I'm Tamika Williams. I'm in the CNM program and I'll be graduating next spring.
My name is Hannah. I'm in the PEDS NP program, and I'm starting my last year, so I'll be done at the end of next summer.
My name's Ariel.
I'm Tara.
Go ahead, Ariel.
Okay, all right. My name's Ariel Cargor. I'm also in the PEDS primary care program, and I'll be finished next summer as well.
Okay. Okay, Tara.
Hi everyone, I'm Tara. I'm in the DNP to FMP track, and I will be, hopefully if all goes as planned, graduating next spring, summer 2022. So here we go.
My name's Cassandra. I'm in the midwifery program, and I will be graduating next summer as well.
Have we missed anybody? I didn't keep track.
Me.
Go ahead.
Hi, I'm Aziz. I'm in the pediatric NP program, and I'll be graduating end of next summer.
Is there anyone else left? I see Dr.
And my name's Christina Lilowski, and I'm also in the midwifery program. We'll be graduating next year as well.
Okay. We gotten everybody? I think so. All right. So I'm going to start. This is a video. I want to say it's like 8 minutes long or something. AHEC Scholars is fairly new to us here in Michigan AHEC, and we'll talk about that in a minute. But Dr. Jillian Binyenda is the person who started it, developed this course, and we've tweaked a few things, but for the most part, it's very much the course she developed, and she has a passion for it that, and she has the history that I think is very helpful for you to see firsthand. So I'm going to play that video, and then we'll come back to this sort of short presentation. So maybe, there we go.
Hi, I'm Dr. Binyenda, the AHEC Scholars Course Director. Our Michigan AHEC team is excited to bring you one of the newest programs designed specifically to address health profession shortage needs in the state of Michigan. You might be wondering what AHEC is. First of all, it stands for Area Health Education Center. The federal government since 1971 has provided funding for 48 states in the United States to recruit, train, and retain a health professions workforce committed to underserved populations. There are more than 300 AHEC designated centers throughout the country. The purpose of the AHEC program is to meet the needs of the communities they serve through robust community academic partnerships with a focus on exposure, education, and training of the current and future healthcare workforce. One of those is the AHEC Scholars Program. The Michigan Area Health Education Center, or Michigan AHEC, was established in 2010 to improve access to primary care for all Michigan residents, many of whom live in areas that have too few health professionals. In Michigan, a 2015 federal report concluded that there are more than 365 health profession shortage areas in the state, and that Wayne, Chippewa, and Montcalm counties have the highest number of shortage areas in the state. Notice that both rural and urban health areas suffer workforce shortages because of the inadequate distribution of healthcare professionals. Public officials identify a great need for medical health professionals, including primary care physicians, physician assistants, nurses, mental health providers, dentists, and pharmacists. Michigan AHEC is committed to addressing these shortages through recruitment and retention initiatives, as well as special clinical education programs. We seek to expose disadvantaged students to healthcare opportunities, expand the number of underrepresented minorities in the health professions, and provide continuing education programs for healthcare professionals. The Michigan AHEC initiative is housed at Wayne State University, but has the potential to impact every resident of Michigan, improving health on a scale that extends statewide. Most especially, the program serves vulnerable populations by positioning students like yourselves toward careers with tremendous growth potential and increasing the diversity and distribution of the healthcare workforce. We have several programs in place to achieve these goals. The Michigan AHEC pipeline programs expose high school students through college to careers in healthcare. There are 5 regional AHEC centers throughout the state, including the Upper Peninsula. That is to allow us to increase clinical placements of students like you in these underserved areas. We also provide workforce development opportunities in urban and rural settings, medically underserved populations, and all the health professional shortage areas in Michigan. The most recent program, and the one I am the most passionate about, is the Michigan AHEC Scholars Program, which is going to prepare you to become a leader in interprofessional transformative practice for those who you serve, and those who need it the most. It's designed for health profession students interested in supplementing their education by gaining additional knowledge and experience in rural or urban underserved communities. It aims to prepare you to enter the health professions workforce by teaching you about health disparities and the role of the community in patient care through interaction with different health specialties. What qualities are we looking for in an AHEC scholar? Leaders who come from diverse backgrounds, rural, urban, and or other disadvantages, those who have a strong interest in providing healthcare to patients in rural and urban, medically underserved communities across Michigan. We want students who have a passion for learning, have a record of academic excellence, and are team players who are interested in interprofessional interaction and lifelong learning. As an AHEC scholar, you will be part of an elite group of future leaders in primary care. You will be able to work with other students and professionals across the state in urban and rural health environments. You will work hard, but as an AHEC Scholar alumnus, you will receive preference for innovative, team-based clinical field placements, in addition to networking opportunities with state leaders and primary care professionals from around the state. What's the timeline, you might be asking? Just exactly what's required. It is a 2-year program that requires 80 hours of effort per year. 40 hours are going to be spent completing clinical and community-based training, and 40 hours spent participating in didactic learning activities. These activities are all done on your time and provide a more in-depth look at topics perhaps you've already been exposed to in your training. Only students within a 2-year health professions program or those in the final 2 years of their health professional training programs are eligible. The required 40 hours of clinical training can already be counted by your own health professional school's clinical training. And the 40 hours of assignments and educational modules can be completed on your schedule with a suggested timeline by each month. The second year of the program focuses on engaging with federally qualified health centers throughout the state to advance patient care outcomes through quality improvement and community outreach activities. The curriculum is predominantly web-based using a learning management system called Moodle, which is accessible from anywhere and any device. This Moodle system is similar to other types of learning systems that you are already using at your own institution, such as Blackboard or Canvas. The educational assignments cover a wide variety of topics in preparation for practice in Michigan's rural and urban communities. The educational and training activities for AHEC scholars will be team-based and will support the following areas. As you can see, interprofessional learning activities, behavioral health integration, the social determinants of health, cultural competency, practice transformation, and current and emerging health issues. Some of these emerging topics include emergency preparedness, opiate addiction, human sex trafficking, and caring for vulnerable populations, such as the homeless or refugees and immigrants. Additional topics and assignments can be selected by students as electives in those areas of most interest. You may be asking yourselves, why should you become an AHEC scholar? First of all, it's free. You also have an opportunity for paid conference attendance, and we provide those information and opportunities for you to not only attend, but also to present. It's also a professional networking opportunity. It's competitive resume building, and you have an opportunity to work with other students around the entire state in urban and rural health environments. And the AHEC Scholars designation gives national recognition of graduates as part of an elite group of future leaders in primary care. We wanted to provide you with a few thoughts from our current AHEC Scholars.
All assignments assist me in my current health profession as a registered nurse in the emergency department. Learning more details about underserved rural and urban areas, their patient population, their health disparities, etc., is very eye-opening and makes me a more well-rounded, educated nurse.
I really appreciate the knowledge that I obtained from completing all the assignments. I understood the basic difference between rural and urban healthcare before completing these assignments, but after, I really increased my depth of understanding.
Overall, I think that the assignments taught me a lot of new information about rural and urban underserved areas. I have recommended this program to many others.
We look forward to working with you to help you build an exciting future for you and for Michigan. We need you, and patients and clients of Michigan need you. Please contact the Michigan.
Okay. All right, so some of this is a little bit redundant. I just felt Dr. Binyana could do a much better job than I could. As you know, it's Michigan Area Health Education Center was established in 2010 to improve access to primary care. So we know that particularly obviously in urban, but also a great deal of the state is rural. And I had read an article not too long ago that indicated individuals sometimes have to go beyond one county, by an entire county, to get to a healthcare provider. So we also want to cultivate a diverse healthcare professional workforce, and one that has that additional education to prepare them well for these underserved populations. So you have advanced learning opportunities supplementing your classroom instruction. So some of it will be information you've already had at some point in time. For instance, motivational interviewing, which is part of behavioral health integration. I think all of you have touched upon it in one course, if not more. And the students who are with me in 7035 this semester will get additional training, but I don't think you can ever get too much of that. It's a hard skill to cultivate. There is a waiver for the social determinants of health, and I'll talk about that in a minute for some of the students, not all of you. But basically, these are the core. Practice transformation actually isn't one of the core things. That's for next semester or for next year too, which you guys will start in September. And basically, that's a practice transformation interprofessional project that students work together with other students in terms of developing a quality improvement project and implementing at one of your sites. And that's really much more for the following year. This semester, this summer, you'll be focusing on patient safety, interprofessional education, cultural competency. I'd like to see that eventually change to cultural humility. That's the more current way of examining cultural differences. Behavioral health integration, that's where the motivational interviewing fits in. It's one module with 3 different areas. Social determinants of health and current emerging issues. And I was listening to Dr. Binyenda and I thought, wow, COVID hadn't even started yet. That was certainly the emerging issue last year, and now it's a current issue. And we always have something new coming up. So for you guys specifically, there have been some adjustments in terms of when you begin and complete things, and there are some things unique to just your backgrounds. So it's not fully a full 2 calendar years in this case. So you're doing year 1 starting today. Supposedly until August 15th, but you are really encouraged to work ahead and complete early if you wish, because that would give you more time off for a bit of a break, which I think all of you will need after this very busy semester you have coming up. Year 2 begins in September and ends this year. We wrapped it up on April 22nd with our poster presentations. So, sort of mid to end of April. Didactic hours for, as Dr. Binyenda said, it's a total of 80 hours, 40 of each of the 2 years, and that's an estimation. And we have included in the course calendar about how many hours or how much time you might expect to spend on any specific module. It's just an estimation. And so it's this year 1, you'll be doing those 6 core topics, and then year 2, you're going to work on practice transformation. For those of you who are in the DNP program, you do a quality improvement project already, so you will not have to participate actually in the practice transformation project. You just need to do the modules. You have to complete over the course of 2 years, and in your case, you don't have a clinical site yet this summer. You don't start that until fall, so you'll do all 80 hours in year 2, and your first semester will enable you to more than complete those hours in the first semester. And Leanne Hudson might have something more to say about that, but and it's primary care focused into professional simulation activities. I'm not familiar with us doing that right now, but it's primarily you partnering with primary care leaders into professional quality improvement initiatives if you are in the MSN program and specifically, and then you have those your placements, your clinical rotations. I am only familiar with one of those rotations because by coincidence, I'm also the clinical faculty with a new grant for the FNP students. So those of you who are in the FNP program, I will be your clinical faculty for this entire, the next year starting September. And then you need to complete a follow-up evaluation 1 year after exiting the program. So I can stop sharing that. Well, that's not true. I'm gonna, first of all, I'm gonna show you the Moodle course and walk you through things a little bit. And then, so if you could have questions, feel free to ask them, and if you don't want to ask them right off the bat, then you can just write them down and we can talk about it later. So you are, this cohort here, AHEC Scholars, year 1, cohort 3, is technically the cohort you belong to. All of those students started most of them did in September, and I think a group of medical students started in January perhaps, and they're just wrapping their semester or their year 1 up. You guys are just starting it now, so you're not in sync with the rest of the group at this point in time, and we have changed some things. So Jill has worked really hard to get this update the site to do the best we can to make it relevant for you right now. So I am going to recommend that you look at, so this is year 1 AHEC Scholars Overview, and I recommend you take a look at that. This one I put today, I wrote up there, is not, you don't need to do that one. There is no discussion board for you guys there. We're already doing a bit of a welcome. You're certainly, and you watched Dr. Binyenda's video there, but you can certainly look at Dr. Tilmangris's, but you don't really need to after today. So this is probably the first thing I want you to really, if you haven't taken a look at this, and probably you have not. So right now you're doing an orientation. That's where we are. We developed this calendar with recommended due dates, but I do suggest that particularly. So this week here, you have in this area here, you have these 3 1-hour modules. This would be an easy area for you in that course of time to move it forward a little bit there too. So you don't have to just stick with that time frame. And I know you have a really busy semester. Having said that, if you can carve out a little bit of time and schedule it in and work ahead, I recommend you do it so you can get a break for yourselves in the summer, end of the summer. We do check-ins, and in the past, they've been primarily not, they've been assignments and our questionnaires have been submitted electronically, but I wanted to meet with you periodically in addition. So our first check-in will be June 3rd. I didn't select a time because I need to get a sense of what time of day works better. For the most part, it will be recorded because if everybody cannot make it, for instance, you're in a clinical placement and let's say we do it during the day, you can't change that. You need to be there. I'm sorry, I guess clinical practice placements, your job. So if you have to be at work, you do. We will put it up in Moodle then, so you can see the recording from that. Then and the 17th, that will be asynchronous, and then we'll meet again on July 15th. And then on August 19th, after the end, there's a questionnaire in the Dropbox format in Moodle. Dr. Nante Smith, are either of the groups, I know is the PNP group DNP program too or not? I can't remember that offhand.
Oop. Sorry.
It's okay.
Am I unmuted?
Yeah, you are.
The FNP students are DNP, and the nurse midwife and PNP students are the MSN program.
Okay, I thought that was the case, and I wanted to make sure that I wasn't leaving out the PNP. I already knew about the midwives. Thank you. So for the DNP students, because you have had an entire doctoral level course for an entire semester on social determinants of health, you can waive that. You're waived to do that. You're certainly welcome to do it. But then you go back to the next part, the social determinants of health, root cause analysis. You're still going to have you do that one. Like I said, I'm hoping to eventually get the language changed. So this is cultural humility.
Excuse me, Dr. Weirs.
Yes. Mm-hmm.
I have a lab that I'm supposed to be attending right now at 1:30 for 70:30.
Oh, okay.
Me too.
Oh dear. Okay, so the rest of it's getting recorded, so you can just catch the the rest of the recording. Later.
Okay.
Okay.
All right. My apologies.
That's all right. It's not your fault.
Thank you.
I do also. Just
Okay.
so you know.
Is this going to be everybody? Probably. Is that right, Leanne?
Just the FNP students.
Oh, just the FNP. Okay. She said 70:30, and I was thinking everybody's leaving. Okay.
But Monday, Tuesdays are everybody else and PNP.
Gotcha. Okay.
So, I guess nurse midwifery.
Okay.
But then the PNPs are on Wednesday.
Yeah, I could have done this at a different time. I'm sorry. Cultural humility, I'd say cultural competency, I was just starting to say, really makes it sound like you're competent, you fully understand, and we can never fully understand somebody's experience, and that's where cultural humility comes in. So hoping to get that changed. But here are the due dates for these. These are Moodle uploads. You can do the training, there are certificates, and at the end of it, and you just upload those and you're done with that. There's the motivational interviewing. So this one is a little bit, you got 2, 4, 6 hours here all together. So like I said, if you work ahead of time, it's better. Those are all due July 8th. And then here are some more certificate. This is all under current and emerging health issues. So you can imagine the emerging health issue has been COVID for this particular year one. It's really, I'd say, moving into the territory of a current health issue. And, don't really know how long that's going to be with us. But at the moment, we haven't changed it because you're year one as the others were, and we're just leaving it as it was. But there are many other things, you know, there's opioid abuse and all that. And then interprofessional practice, there's a quiz, and that just has to do with, you do a team step kind of thing. So that one I think is a fairly lengthy module. I don't know why I don't have it down there. So the idea though is truly is if you can get through this stuff sooner than later, and I know it's a busy semester, it would be, you know, you're certainly welcome to do that and be finished before August 15th. So, you know, so that's entirely up to you how you handle that. Certainly want it all done on time, but you can work faster. There is a survey that you need to be taking. It's a pre-survey for the new grant students. And that would be after you finish this, but before you start year two. Dr. Nante-Smith, am I just explaining that part correctly?
I can give just a little bit like more detail. The QI survey assignment it's the new grant borrowed this activity from AHEC scholars, but we need for the new grant, we need your pre-test data before you have activity or access to the module itself. So right immediately following this meeting, I'll be sending you guys an email with the pre-test. And then the due date for that pretest is this upcoming Thursday. It's just a pretest. You don't have to study for it or anything. Just give us your best guesses on everything. And then once everyone submits their pretest scores, we'll add you all into the Moodle and you'll have access to the actual activity. And that doesn't need to be completed until June 28th, I think it is. I have it all in the email ready to send.
Super. Yeah, I did have that a little mixed up. So thank you so much for that. So, so this introduction to Michigan AHEC, I'd like you to watch that too. This is a syllabus. Now, just bear in mind that the syllabus was developed to start last September for the group that's, you know, for the bulk of the students who started then. So some things have changed a little bit. As long as you're following the course, that I just gave you, that summary, that calendar, you'll be on track. So some of the things you don't need to worry about in this so much, but you know, I'm not going to reiterate everything in the syllabus. The expectation is you read it. Basically, these are there's a program overview. We've talked about this stuff already, so you will. It's a 2-year program. You already know that. We've already talked about these things, the learning and didactic activities, and that you have the 6 core topics this year, and then practice transformation next year. Let's see here. We do ask you, and I did notice in Moodle, it looks like there's something out of order. So, but Jill has put those dates in there for you, and I will draw your attention. We'll look at that in a minute then. And the grading, don't worry about the points so much and how many you're accumulating. Just get through the assignments, you know, do a good job on if you're asked for a reflection, you know, respond to things accurately. Just make sure you're uploading everything. And there's a little bit of discrepancy in, well, at least there wasn't year 2 in the actual course. Compared to the syllabus, and I assume that might still be the case here. So if it seems like it's a mismatch, we'll keep an eye on it, and you don't really need to worry about that. But there is information here about these activities you've got, and a rubric here. And then the clinical activities, you don't need to worry about that until next year. So, so just read through this stuff, and this is where year 2 starts. That's what I was looking for. So in that, you don't even need to go past that. You can worry about that then. Okay, so you'll notice some of these are dates from last year, so that you know you don't need to do these. This one is not due till, and this is the last one you're actually going to do. So this is August 15th. So this is one that I think is a little out of. I don't want to try to move it around and, you know, lose it or something. So So this is to be done by May 20th. And if you go back and you'll look through the calendar and you'll get a sense of how much time those things will take. So this is a new grant. Students look below, which is right here. Here's your check-ins. So I guess I need to get a sense from you guys. I think what I'll do is send you out a poll and get a sense of what time of day works best for you for those live meeting check-ins. So that would be on the June 3rd and the July 15th. I'll send it anonymously and basically, with the majority rules. And for those of you who can't attend those, then it'll be recorded. And you're always welcome to contact me with, if you've missed something in those and you have a question about it. You can ignore this part. Is that right, Leon? Did he leave? Maybe he did.
Oh, sorry, I was on mute. Yeah, we'll get those dates together. I believe that for this first year, we won't be sending those out. So those
they'll do it next year.
Yeah, we'll probably hide those.
Yep. Okay. So the FNP students, which they are the only DNP students apparently, this activity, they're waived from it, but the others are June 10th. And I know who the three of you are. There's cultural competency. And so there are three things here, and here the due dates are here. You just sort of have to look for what Jill put in there. Behavioral health integration here. So you can see the elements of motivational interviewing, motivational language, and processes of the encounter. And then this is the emerging health issues. So if on top of that, and in all the spare time you have, if you want to do elective topics, you are welcome to do that here. So I am pretty positive you guys will be working hard to keep up with this stuff. So, all right, I'm going to stop screen sharing unless somebody wants me to scroll through something here that they wondered about.
Okay. I did have a question. I'm sorry. Okay. You said that once we fill out the survey, or not the survey, I'm sorry, the pre-quiz, then we'll get a login to be able to log into this, or should we have already been able to log into the Moodle?
So, Jill, is the course open for them already? No. Okay. So do you and Dan communicate about this, or how does this work?
Dan just explained that one. Dan, can you go through that again for us?
Yeah, so once you complete the pre-test for the QI modules, then we will give you access to the Moodle and be able to look at all of the assignments. Because we just want it to be a very true pre-test. If we give you access now, hypothetically, you could cheat. Not that we think you will, but just to be safe.
Okay.
Okay. All right. Thank you.
All right. Let me look in the chat here. Oh, you did turn.
Your access to Moodle will come from an email from me.
Okay.
So be looking for an email from Leon. As soon as Dan says go.
Okay. That was what I was trying to understand, how that was all going to work there. So, okay. What other questions do you guys have?
Dan, did you let the students know, aside from AHEC, that there are a few other things they're required to do for us?
I had not gotten into it yet.
Okay.
Go ahead.
Because a lot of that will be in future semesters and be covered under the specific ANU orientation rather than the AHEC orientation.
Right.
But if you want to give them an overview.
I just wanted to let them know that AHEC Scholars is a requirement, as has been stated, and it's a 4 semester as opposed to the 2 years, and it's kind of been, adjusted for the new students to participate. But as Dan said, the QI section is part of the AHEC Scholar, but you'll be doing a pre-test and post-test for me as the new grant person. And then you will also be doing cultural competency modules, and you'll get that link from us. And then there are 2 other topics. One of them is value-based care, and the other is primary care medical home model. And you will get the pre-test from us, and then the articles, there'll be a link in the articles that you need to read, and then there'll be a post-test, and that is separate from AHEC. Okay.
Okay. What other questions? Anybody have any more questions? My thought is once you have access to the course, once you start looking through it, if, certainly shoot emails and ask those questions. But I like I said, if you look at that course calendar, the idea of adding that to this was so that you would at least have something you have to follow, that you can see what you need to get done and give you some kind of time frame to expect that. The other thing is when you click into those modules, very often Dr. Binyenda, I believe, had included estimated times for some of that stuff, or somebody did. So some of that's in there if I missed any of it in the course calendar. And like I said, I will send you an anonymous poll about what time of day is best for you guys to have. And if you're in clinical, in your job as nurses, I don't expect you to, try to take off during the middle of taking care of patients. So it'll be recorded, and you're welcome to ask questions if you have them afterwards. Anybody else? Okay. I'll see some of you tonight. Okay. All right. You take care. Thanks everybody for joining. Thank you, Dan and Jill and Leon and Dr. Nancy Smith. All right. See you later. Bye-bye.
Bye, everybody.
Bye.
Bye.
Thank you.